Hi, I'm Dr. Anil Shah, and I'm going to be talking today about osteomas. So an osteoma is a bony outgrowth of the forehead. Osteomas can occur either naturally, but oftentimes when I talk to patients, they have a history of trauma. Many times it's 10 to 15 years ago, and some small traumatic incident has caused this slight bony outgrowth of the forehead. So removing an osteoma can be done in several different approaches. The traditional approach to remove an osteoma involved one of two techniques. The first technique was to make something called a coronal incision. A coronal incision goes from one ear to the other ear, and with this incision, the entire scalp is peeled forward. Oftentimes when you do this technique, you're going to cut the nerve that provides sensation to your scalp. Now this doesn't sound like a big deal, but if you ever comb your hair and you've lost that sensation forever, then it can be pretty disheartening. Another technique to remove an osteoma is to make an incision directly in front of the osteoma. The problem with this technique is you're trading a bump on the forehead for a scar. And even if it's a very difficult to see scar, it's a trade-off for the patient. So I've developed a technique where I hide the incision in the scalp. By hiding this incision in the scalp, oftentimes with a 1 to 2 centimeter incision, I can locate the osteoma with an endoscope and remove this from the small incision. The benefits of this technique is it's a limited dissection path. With a limited dissection path, patients will have less swelling, less edema, and a faster recovery. The other benefit of this technique is that the osteoma can be removed in an office setting. With the coronal approach, the patient needs to go to sleep under general anesthesia. This makes this procedure, which can be quite scary for some patients, into more like a dental procedure. When patients are done, they can get right up off out of the chair. I have patients who fly in from all over the country to have this done, some flying out the same day or the next day. Hopefully this is helpful information for you about learning about osteomas and different ways of removing osteomas from the forehead.